Today on the Unveil Podcast, I bring you an interview with Dr. Jack Ginsberg PhD. Dr. Ginsberg has an illustrious biography. He earned a BS in biology cum laude from Yale University, an MA in anthropology from Brandeis University, and in psychology from Boston College, and a PhD in clinical neuropsychology from the University of Memphis, Tennessee. Presently, he is a licensed clinical psychologist, neuropsychologist in South Carolina after retiring from the Columbia VA Hospital in 2019. He is currently also adjunct faculty at Saybrook University in the departments of Applied Psychophysiology, Clinical Psychology and Research, and he is a research associate professor at the University of South Carolina School of Medicine. Dr. Ginsberg has been a PI, co-PI or co-I on research grants from the Department of Defense, VA and NIH, studying heart rate variability and heart rate variability biofeedback in patients with either chronic pain or PTSD. And currently he is collaborating with researchers at Virginia Commonwealth University School of Medicine, Duke University School of Medicine, and the University of South Carolina School of Medicine on grant proposals under review by NIH and DoD to study heart rate variability and heart rate variability feedback. There is yet more on Dr. Ginsberg's professional bio in the show notes, and today we talk about heart rate variability. We discuss Dr. Ginsberg's journey to get to his research in heart rate variability some 20 to 25 years ago, before this was cool science, and we discuss the way that he uses heart rate variability both as a tool but also as an observational metric within his patient population and the research that he does. Today's podcast is a deep dive into what heart rate variability actually is and what it is indicating about the human physiological state and nervous system state. And Dr. Ginsberg and I discuss in quite some depth the nature of respiration and how it impacts heart rate variability and why. We discuss the mechanisms of breathing and how it regulates heart rate variability, and blood pressure. This is a really fascinating conversation for anyone who's even vaguely interested in health optimization and the regulation of the nervous system. Dr. Ginsberg and I today take a non-clinical approach to this, and we focus less on his work with complex chronic pain conditions and PTSD and more on the regular human being who simply wants to have more flexibility and adaptability in their nervous system for holistic human health. As you can probably tell from this introduction alone, this is a dense episode filled with lots of explanations, but Dr. Ginsberg does a phenomenal job of making this not only easy to understand, but directly applicable to your life today. With that said, please enjoy today's episode of the Unveil Podcast with Dr. Jack Ginsberg, PhD. So today I would like to welcome to the Unveil Podcast, Jack Ginsberg. Thank you so much for spending time with me.
It's my pleasure. I'm looking forward to this.
And I want to give our listeners an overview first into who you are and what you do, simply because I feel like you and I could go very deep into the science on today's episode of all the things you research and all the things you look at. But let's start simple. Let's start with the basics. So give us an overview as to your current role, current career, progress, all of those sorts of things, and where your passion lies in terms of your professional work at this moment in time.
Okay. Well, I certainly could go on at some length about that. And I don't want to sound too much just like a written bio either. So I want to give you sort of a flavor and an impression of what I've done and who I am and what I want to do and why I'm doing the things that I'm doing. It's hard to know exactly where to begin with that. I'm from Georgia originally, so I think of myself as a Georgia boy. Mm-hmm. And I had good fortune to have a truly excellent education, secondary prep school at Phillips Exeter, and a bachelor's degree in biology from Yale, and then a graduate degree in psychology, a master's in psychology and a master's in anthropology, and then finished it off with a PhD in clinical neuropsychology. And that's where I was when I started on my work. I was a psychologist in a state psychiatric hospital helping people. I think of myself as a helping professional. And one of the principles that guides me is that education has as its main purpose service to others. And I abide by that. I try to use the education that I've had and my knowledge to apply it in some way to benefit other people. as is said in the Jewish tradition, tikkun olam, to heal the world, do something to help make things better. And I have two main avenues now for that. One is through clinical psychology and working with people, and the other is through some scientific research, looking for discoveries that can be applied and be used to general benefit. And those two things go together, or they came together in some research that I got very interested in about 20 years ago. I was working at the VA, and my research mentor there was doing some studies on post-traumatic stress disorder in combat veterans. And his approach was to use eye blink conditioning as possibly a mechanism or associative learning, which may underlie the persistent traumatic reactions that people have. And PTSD is for combat veterans is not considered to be qualitatively different than PTSD in a civilian population, whether it's criminal assault or car accidents or natural catastrophes, fires, floods, and so on, or even childhood abuse is a precursor for post-traumatic stress disorder. So he was looking for basic mechanisms or underpinnings that could be used to not only explain the heterogeneous symptoms that go with PTSD, but also a way to try to undo or create extinction of the traumatic memories and enable the person to live a more open, free life without the constant repetitions and memories and so on. But I got interested not so much in that, coming from my background of neuropsychology, as I wasn't interested in learning and what we call cognitive learning, just the regular old, learning new information, not so much associative conditioning. So I had some of his data, and I got very interested in that data set because it did include a heart rate variability variable, as well as some cognitive tests, word list learning, story memories, things that a clinical psychologist would use to assess a person's everyday memory. So I began looking more deeply into that and found that there were associations between heart rate variability, which I know we're going to talk about in more depth later, between heart rate variability and learning. And it wasn't very difficult to uncover that heart rate variability is also, and understandably and reasonably, a factor in the symptoms themselves, in the stress reactions, the anxiety reactions. Heart rate variability is a measure really of stress reactivity. And it's simply put, it's how your heart responds when you're faced with stress. And it's not so much the cognitive aspect of it as it is the physiological response. And that really set in motion the rest of the work that I've done since then. This heart rate variability has proven in the last 20, 25 years to be incredibly important and very widely appreciated now. Its value goes well beyond PTSD, although PTSD is really an exemplar case of where heart rate variability can be used as a portal to understand what's going on in the individual, as well as a treatment target. So since then, I've done a number of studies with heart rate variability and post-traumatic stress, as well as chronic pain. Through the VA, I had awarded some funding from the Department of Defense and from the VA to do these studies with heart rate variability and chronic pain. And they proved to be very productive and showing associations and relationships. And alongside of that is the intervention, which is commonly practiced now, heart rate variability biofeedback. And heart rate variability biofeedback is a very simple intervention, although some training is required in order to teach others to do it. But it is also self-empowering. People can learn to do heart rate variability biofeedback on their own. It's something which you can either get help from a professional, or with practice and with maybe a little bit of luck, you can learn on your own. And it's taken off from there in the last few years. Heart rate variability is now being used as most likely as a public health level screening tool that could be indicative of chronic illness, including diabetes and cardiovascular problems, as well as sensitized pain, PTSD, and most interestingly and very exciting, it's also an aspect of elite athletic performance. And a lot of coaches in colleges use heart rate variability biofeedback and measures or assessments of heart rate variability to help train athletes and to improve their performance. So it's as simple as it seems. It's incredibly powerful as a way to understand the relationship between physiology and what's called the behavioral phenotype, or kind of what you're expressing, how you're adapting, and how you're living in the world, or orienting in the world. And so that sort of suits all my needs there. So it's a perfect fit for me. I'm no spring chicken. I actually reached the end of my professional career a couple of years ago and have gone into semi-retirement now. So I don't actually have to go to work every morning, but I still keep myself very occupied in my home office, pursuing some research studies. I have a couple of collaborations that I'm very excited about, one of which is using music in the surgical operating theater as a way to improve outcomes and reduction of opioids after surgery for knee replacement. And some others probably as well. But and I do a little bit of the clinical counseling on, not so much counseling, but consulting. I do a little clinical consulting on the side too. So I work in all of that and try to make sure that I also have time for a little bit of yard work and other things that I really do enjoy, so I can have a balance. And it seems to be working very well now. So doing some podcasts now, people are referring me along, and that's how I met you, Victoria. And I've done a little reading on your program here, and it's a very interesting one. I like to say that, all roads lead to sort of a final path. And so whichever track you take, whether it's biofeedback or meditation or yoga, and your program as well, I think it ultimately is designed to reach a state of physiological balance as well as mental comfort, emotion regulation. Those would be the two major principles, I think, that I see as being a desirable goal for all of us who are trying to help others and who are, have the helping gene, you might say, is to regulate your physiology as well as have emotion regulation. And when you can do that, you can be in a relaxed state, alert and in control of yourself and manage stress. We don't strive to eliminate stress. What we do is improve or maximize our coping with stress so that as it comes along, we handle it and we manage it. And then we can return to a baseline level, which is, again, comfortable, relaxed, balanced, alert, and really overall happy. That's what we're trying to do.
Thank you so much for that overview and introduction. And all of my regular listeners will now be completely aware of why you are a guest on this podcast, because the way you speak and how you've approached all of this is very much what we like to do at Unveil. It is that, how do we increase our innate resilience in any way, in whichever kind of avenue, but also with this passion of using these tools in the right way. And to have to be introduced to someone who was with heart rate variability 25 years ago is huge for me, because I've been working in healthcare for a while now, and heart rate variability has exploded as this kind of metric that we're all tracking on various devices, and people say things and I'm like, do you actually even understand what you're talking about? And I really feel like there's a lack of kind of first principles understanding of these metrics, which I feel diminishes people's ability to use them sometimes. And, we have these, we spoke briefly about the Aura Ring, which has heart rate variability as part of a complex algorithm that creates what is called a readiness score, which has only a fraction of heart rate variability included in it. And it frustrates me, because I then look at it for myself and I break it all down and I'm thinking, well, this, that, and my sleep's over here, and that's a different score over here. And it's complex, but that's not necessarily explained. So what I wanted to do today is to really get the expert, somebody who's been around HRV long before we had beautiful little apps and tiny rings that can track it, to really dig into what this is, why it's important, how we can work with it from a personal or professional level, and to just explore this territory of the applications of feeling like we can have this observable metric, which we can now measure much more easily in our own lives, and what we really can do with it and what we're looking at. And that's kind of the conversation I wanted to have with you today, because you are one of the experts, the world experts, in my view, on this topic.
Well, I thank you. I don't know about that last part, and there are many others who are doing research in heart rate variability, and it is not factorial, but it's sort of like a crystal that has all these different sides to it. And you can turn it this way and that way and see a lot of different aspects, see a lot of different things in it. And I want to take off from some of the comments you made. It is true, certainly, that advances in electronic technology have enabled use that even 20 years ago was just not available, like recording and analyzing the data. Back in the day with ECGs, which had ink and traces and everything, it was frightful to get the data out, which is what my mentor, Dr. Powell, was doing. And so the advance from there till now with easily acquired fingertip sensors or earlobe sensors, and readily available software programs that can process the data instantly and give you a score or some type of number, has enabled the widespread application of it, and guys like me to kind of hook onto it, and has enabled a much deeper, more readily available understanding of it. And I think I also want to emphasize what you said, that it seems so simple. And that's misleading. And the word for that is called apophonia. Apophonia, and this is in some of my lectures and things, apophonia is the idea that you can see patterns where there really aren't patterns there. Or you can sort of have this idea that you are reading, interpreting something, but it might not actually be there. And so there is a danger or a risk of apophonia in heart rate variability, because many people really don't understand the depth of it. So while on the surface, it seems really simple, just measure heart rate by putting on a fingertip or earlobe sensor, it is so deep and it's so complex. And while a practitioner or a user, consumer, doesn't have to understand all of the physiology, what's on the surface of that are the variables that we are going to talk about. And it's those variables, I think, which give us an insight then into what we're really talking about, so that we don't skip from looking at a recording or an index number and make assumptions which might not really be fully supported. So I would say that the more you can understand about it, the more you can appreciate it, and use that same caution, which is don't so avoid thinking that a simple measure or a simple recording is all you need to understand about yourself or that other person. And it's very valuable to understand how heart rate variability, what it's reflecting, what the depth of it is. And once, as you get more and more involved in it, you can appreciate more and more what's going on physiologically and in terms of your emotions and how those things relate. So it's a wonderful vehicle for self-understanding and self-control. And back in the day when one of the therapies that was called the top-down therapies, I got very interested in, and I'm still a practitioner of it and an advocate, is rational behavior therapy, or rational emotive behavior therapy. And the two go together so well. And to me, that is confirmatory that RBT, which I've always thought was the right way to go for individuals with certain types of behavior disorders, was so useful and so powerful. And now to see that, in fact, it is also reflected in heart rate variability is confirmatory, that these, we're doing the same thing here. We're helping people learn how to manage their physiology and their emotions, and how those two things, the bidirectionality between emotion regulation and physiological adjustment.
I love that, because that's exactly how I use it in my practice. I track my clients, but not necessarily to focus specifically on the physiological elements of how we can interact with heart rate variability, but the total shift in terms of coaching with me, working with me. What is the net positive, hopefully, if I'm doing my job correctly, outcome within the client's ability to be with and self-regulate more. And that's jumping all the way to the end. And we are going to now dig into the science, but this is exactly, I think we have a very shared perspective of the utility of this. And also that shared frustration with the kind of, you can't just jump to the endpoint because you don't really know fully what you're talking about unless you actually understand what are these numbers, what are these millisecond readings, or what does any of this mean? So this is going to be the segue where we're going to dive into what actually is heart rate variability. And I would love for you to give us an explanation of what we're actually measuring, how we're measuring it, and what are the numbers that we're actually looking at as the end result when we see our heart rate variability score, let's say.
Well, you touched on it when you said in milliseconds. And so the single foundation of heart rate variability is the time interval between heartbeats. Now, let's think about that for a minute. If you have, when the nurse takes your pulse in the clinic and she puts her finger, or he put their fingers on your, right here on your wrist, and they look at their watch and they're waiting either 10 or 15 seconds and they're counting the number of pulses. And they then convert that by multiplying by 6 if it's a 10-second reading, or by 4 if it's a 15-second reading, into beats per minute. Okay. Now, an average heart rate and a healthy heart rate would be 60 beats per minute. Well, let's think about that. What would be the time interval on average in between beats if you have a heart rate of 60 beats per minute? Well, the answer is 1 second.
1 second.
If your heart is beating at a rate of once per second for 60 seconds, you'll have a heart rate of 60 beats per minute. Well, that's the foundation of it. And we can begin and go from there because it gets very complicated very quickly. The first thing to understand, important is that your heart is not a metronome. Your heart should not beat regularly, evenly at 1 second every second for 60 seconds. That is not a healthy heart. A healthy heart should have variation so that some beats are longer and some beats are shorter. And it's the pattern of that long and short that constitutes heart rate variability as a measure, as well as an indicator of the health of your heart. Now, if your heart is beating at 1 second every second for 60 seconds, the heart rate variability of that is 0.
Yeah.
There's no variability. Every beat. And there's a little term, it's called interbeat interval, or IBI. IBI is the way to talk about individual beats. So when the nurse is taking the beats per minute, they're averaging over a time unit. They're not giving you a measure of what is the unit or the score, the time frame, the interbeat interval of each heartbeat.
Yes.
Okay. If you measure, as you can easily do now with these recorders, as I was mentioning, fingertip and earlobe, and you look and you see that the interval between two beats is 1,000 milliseconds. That's 1 second. You can derive from that what's called an instantaneous heart rate. And that's not averaged over any time unit. That is what your heart rate would be if that individual beat were, you might say, enlarged or amplified over a unit of time. So these IBIs now will give you a series of instantaneous heart rates. Now, if the one IBI is 1,000 milliseconds and the next one is 900 milliseconds, well, that's a little shorter time period, which means your heart's beating a little faster. So if your IBI, if you have a segment of readings and your IBIs go 1,000, and it's really preferable to speak in terms of milliseconds, because then you don't have to fool around with decimals. So if you have IBIs that go 1,000, 900, 800, 750, you can see that your heart rate is accelerating beat to beat. And it's that beat to beat. The crucial thing is this beat to beat, interbeat intervals, the pattern of interbeat intervals that changes. A healthy heart has the sinusoidal pattern, where it goes faster, slower, faster, slower. So just as an example, if you are recording, and you can't detect an interbeat interval by putting your finger on the wrist, as is done in the clinic.
Yeah.
It is said that some people are really able to discriminate IBIs with a stethoscope. And I believe that's possible, but it's just not what you have to do. You really have to use a recorder. You have to use an electronic recorder to pick up these tiny changes, because a change in interbeat interval could be as little as, let's say, 60 or 70 milliseconds. And, that translates into like a tenth of a second. And it's very difficult to detect that without electronic devices.
Yeah.
So if you see a trace of IBIs and it goes something like 1,000, 900, 800, 750, 800, 900, 1,000, you can see how you're getting these peaks and valleys.
Yeah.
And the heart is, those instantaneous heart rates are going from, let's say, 55 beats per minute. The instantaneous heart rates, not averaged over time, but the instantaneous heart rates are going 55 to 61 to 72 to 75, back down to 74 to 70, and then all the way back down to 55. And that's the sinusoidal pattern. That's the sine wave, where you have increasing and decreasing in a very regular pattern. And that's a beautiful heart rate variability. By having a sinusoidal or a pattern, a regular pattern of increasing and decreasing IBIs, which reflects decreasing and increasing instantaneous heart rates, you have a healthy heart. A healthy heart should vary, not jumping from 55 to 71 to 62 to like that, so that the average, it should be this regular, smooth increase, decrease, and that's the sinusoidal pattern. And when you see a trace, and the software will convert those IBIs and those instantaneous heart rates into a graphic representation. And that's called the tachygram. And in most software programs, not something that just gives you an index score, but other relatively available software programs. And without endorsing anything, there's several that are available. I use Kubios in my research, but they give you graphic pictures of these instantaneous heart rates. And when you look at a healthy heart, you see that it sort of looks, nice and smooth, up and down, up and down. And so now the next question is, what are the highs and lows? What are the max and mins? And the greater the amplitude of your sinusoidal pattern, the healthier your heart is. So a trained athlete may go from 48 to, I'm going to say maybe 81, have a 30 beat instantaneous heart rate change from low to high. Whereas someone who's not healthy may have a max to min of only 6 or 8 beats per minute. And so that heart is not exploring the full range of physiology that can be controlled by, and here we have to take another step. This is all being controlled by 2 major factors. Respiration is the most important. Respiration has a direct link to this heart rate variability. So when you and I are sitting here talking, we're breathing normally. We're breathing at maybe 15 beats per 15 breaths per minute, let's say. You're going to get, ideally, when you're sitting at rest, and by the way, not speaking, you really can't have a normal heart rate, or speaking is, you might say, a stressor. It's a challenge to your physiology. So you don't expect to have, so these heart rate variability traces are at rest. And when you're sitting quietly and you're not being stressed, you're not being challenged, and that gives you your baseline heart rate variability. So if a baseline heart rate variability is showing max to min of, let's say, 8 or 10 beats per minute with a 15 breath per minute cycle, we'd say, well, that's pretty good. When he's resting, he's still getting a little sinusoidal pattern, max to min of 6 or 8 or 12 beats, whatever it is. And that's relatively healthy. So you and I at rest might have a max min, which is a measure of heart rate variability. It's one of the simplest measures. The max to min over a breath cycle is a simple indicator of heart rate variability. So at rest, for a normal, untrained heart, you might say, breathing at 15 beats per minute, I would say maybe anywhere from 8 to 12 max to min for a healthy heart would be reasonable. That's what you would expect. Now, to measure that, you have to add another level of measurement, which is respiration. You have to know when a breath cycle begins and when a breath cycle ends. So heart rate variability is all about cycles. And cycles means frequency. Frequency means how often does that cycle begin and end. So heart rate variability has a cycle of max to min, back to min, or max to min, back to max. And that's a full cycle.
Sure.
And the length of that cycle is governed by your respiration. The more rapid your breath, the shorter the heart rate variability cycles are, because respiration is driving these very tiny changes in IBIs. And the ideal, so now we sort of understand that respiration and heart rate variability cycles are intertwined.
Yes.
They're related. So breath will tell you a lot about what that cycle of heart rate variability is. And what the cycle of heart rate variability is will tell you a lot about of what the cycle of heart rate is, will tell you what the heart rate variability is. The shorter the cycle, the less room there is, you might say, for max to min. So you want a nice long heart rate variability cycle that corresponds to respiration. That means slow down your breathing. The slower your breathing, the more time there's going to be for this max to min to develop. So you go, up and down the mountain, so to speak, up and down the hill, the min to max, at a slower rate, and you get greater amplitudes. Slow breathing will generate higher sinusoidal or max to min heart rate variability. That's a very simple, maybe the simplest way. That's sort of the top level here. So breathing, controlled breathing or regular breathing is the most important thing. If your breathing is irregular, if you have one breath cycle that's 8 seconds long, and the next one is 12 seconds, and then one after that is 16, and then the next one is 14, and then the next. If you don't have a regular breath cycle, the heart rate becomes all disordered. So the first goal in improving or training heart rate variability is just regular breathing. Regular cyclic respiration at some cycle that's comfortable for you. For most people, it's 12 to 15 breaths per minute. That's typical. About a 5-second respiratory cycle is, about 5 seconds, 2.5 seconds in, 2.5 seconds out. It's typical. So that's a reasonable, but that's not the best you can do with breathing or heart rate variability. And as you begin to slow down your breathing until you hit the sweet spot, which we're going to talk about, the resonance frequency, as you slow down, these waves of heart rate variability, max to min to max, they increase as well. And now you're beginning to explore a larger range of physiological control. Well, that's better. That means your heart rate you might think of it metaphorically as enlarging the net, where you can now take intake of greater stresses or of greater challenges in the environment, because now you're exploring different levels of physiology, both increased and decreased in terms of your heart rate. Now, a simple rule is that faster heart rate implies a higher level of sympathetic or the fight or flight. Faster your heart goes, or the more norepinephrine, the more your heart will accelerate. And those are stress responses or challenge responses. And when I say stress, you can think of that as eustress. You're familiar with the term eustress as opposed to distress. So in normal everyday stress, certainly, affects your heart rate. So if you're going into a podcast, you got to catch the bus, you got to take a test, you're going to meet your boss, or, you got a deadline, that's normal. Those are normal stress challenges. And you want your heart to be able to speed up or to generate the energy that's needed with the whole, you call it fight or flight, but it's just adaptive. It's an adaptive strength. It doesn't have to be a life-threatening stressor in order for your heart to respond in a healthy way by having sympathetic heart rate acceleration. On the other hand, you want to be able to exist in a rest and digest state, a relaxation state. And that's the parasympathetic, and that is reflected in a slower heart rate. Now, the amazing thing about it is that we're talking on a time frame here, which is, on the order of seconds.
Right.
So your accelerations and decelerations of heart can occur very rapidly within 10 seconds. And that's sort of the sweet spot. When you start breathing around a 10-second breath cycle, and your heart then gets entrained with a 10-second cycle of max to min, you're going to hit the maximum amount of rest versus stress, rest versus, let's say, response, rest versus response. Now, it doesn't mean that every 5 seconds you lay back and every 10 seconds you get excited. But what you're doing, you're training your heart so that your heart will be ready to recover or adjust or adapt to whatever the environment is. So that if you've got into this larger amplitude heart rate variability, when it's time to rest, you have access then to a greater parasympathetic state, because your physiology now is generating a larger component or a slower heart rate, which is then will adapt with a rest and digest versus, again, when there's a serious stress or a challenge, your heart is now able and ready to have greater acceleration and respond with a higher level of sympathetic or, fight or flight or stress challenge, mountain stress challenge. Now, that's a good way to start to think about it. But I do want to put in another thought here about this, that as your heart, is accelerating and decelerating with breath. Remember this. Inspiration, breathing in, is heart rate acceleration. Your heart will accelerate when you breathe in, and it will decelerate when you exhale. That's a fact. That's a physiological fact. So even if it's only a 5-second, 6-second breath cycle, you will still get a tiny heart rate acceleration on inspiration and a tiny heart rate deceleration on exhalation, on expiration. So that's sort of the way you have to think about it. So you want to think of it as when you breathe in, you're generating a nice high peak on your instantaneous heart rate. And when you exhale slowly, you get a nice low, you get a valley, because the parasympathetic, the rest and digest, is kicking in. Now, again, this doesn't mean that behaviorally you're going with these small changes in your heart rate. It doesn't mean behaviorally that you're going from rest and digest to stress reactivity within a breath cycle, but you're sort of training your heart, you're preparing your heart for whatever environmental challenges or whatever you need to respond to. So if you need to rest, your heart understands that, and you have a good, strong that's called the parasympathetic branch, and you can rest. And so you're not sitting around responding to a challenge when you're resting. Right. So you're in trouble if you're doing that. And conversely, if you can't generate a stress response, if you're too much into parasympathetic, then you can't deal with challenges. Now, that's sort of the surface level of how it is that breathing and heart rate underlie what we observe as heart rate variability, and how you can interpret that in terms of its behavioral utility in dealing with stress challenges, as well as being able to relax when the opportunity, as being able to rest when the opportunity presents itself. Sure. Now, I want to take you on from there, but I think I'll stop for now and do a little check. Yeah, that's right. Let's do a little check.
What I love about this is that so many people talk endpoint theories. They explain, do a longer exhale in breathing work, or they say, slow down your breaths, or they say we need to create more space. And the reason I've always been slightly obsessed with heart rate variability is because it's the what we're doing with all of this. And everything that you've just explored and explained is that expanding the ratios and the space at which we can modulate our response to the environment. And essentially, the more we can do in response to the environment, the more variety we have in terms of the mode and the orientation we take to what's in front of us, and the more extremes that we can access, the more we can stay in the center, and the more we can go to the edge as and when needed. And that's the essential element of this human organism. As you've so brilliantly put. It's not designed to be in any one state consistently. And it's also not always going to shift everything about behavior just because we're doing this ebb and flow of sympathetic, parasympathetic within every single breath. Fractions of a millisecond probably difference, but that difference in ebb and flow, but it is in exploring the full variation of our potential reactivity and responsivity to the environment as a mammal that we actually are healthier humans. And that's what heart rate variability and all of these IBIs and the numbers and the breath rates and all of that, that's what we're talking about when we get into this realm of physiological assessment. And I think that's the bit that people don't fully understand, or if they do grasp it, they don't get that this kind of number that you can get in one app is actually a very complex graph underneath with all sorts of rhythms and all sorts of kind of energy underneath it that is bidirectional relationship as well. So you can affect your heart rate variability with your breath. Your heart rate variability will affect your breath. So there are all of these biofeedback loops happening. I'm fascinated by the music thing that you mentioned right at the beginning, because I'm a musician, and you don't know this about me, but I do love music, and I use music to entrain my own nervous system into the thing that I want to feel at that moment in time. So it's all of these things we can use our environment to support our physiology to be better oriented or more broadly oriented to the environment is kind of what we're saying.
And I like the way you said that you're not going to see observable changes just as a result of doing this behaviorally. So the idea is that what it really widens is your adaptability.
Yes.
It gives you a greater range of environments within which you can adjust. And so, we can go several different ways from here. One would be this idea of top-down control, which is very important. And that goes under the domain of emotion regulation. And the two, while they are very tightly intertwined, emotion regulation and the physiology, the heart rate variability, you can also look at them and measure them separately. So they have, you might say, they're separate domains, and they don't exist independently in the real world, but in terms of our approach as helping professionals and in terms of measurement, motion regulation is a really key feature to producing this heart rate variability increase or maximization, as well as restoring normal. When you see disordered heart rate variability, you can be fairly certain there's something going on. If you don't have normal heart rate variability, something which generally can be approached through emotion regulation. So, there are two ways you sort of come at it from two different directions. The biofeedback directly operates on physiology. It directly operates on your heart rate through breath. And, a lot of arguments about was all you need to do to breathe slowly in order to, have this well-adapted behavioral phenotype. And my answer to that is no, that without the emotion regulation, which is a different set of tools, and it's a different set of outcomes, a different set of measures, in order to truly experience health, holistic health, I think we have to learn how to do the emotion regulation. And the two can be independent. Now, does improved heart rate variability add to emotion regulation? That's kind of an empirical question. And so my answer is, if you're well adapted, if you have a stronger physiology, yes. But emotion regulation can be trained or approached separately from direct physiological intervention. But they get together. And so now we can talk about meditation, we can talk about yoga, we can talk about music, we can talk about a lot of other things that operate more directly on the emotion regulation and how that then bidirectionally interacts with heart rate variability. So now we sort of get this ongoing feedback system, a positive feedback system, so that you begin to feel better and you act better. Your resilience is increased, and it's especially important for people who have clinical disorders. Although it's, as I said, it's also useful for self-help for people who just want to feel better and do better, as well as for athletes who are at the level of elite performance to reach their maximum physiological as well as cognitive level of performance. So, but I have to say, we all have our limits too. So we don't want to see this. We're not just being able to climb higher, run faster, and lift more weights doesn't mean that you've really achieved holistic health. It's a good thing. It's a part of it. but there's more to it than that. And so to really be, a good person, you might say, and I think that's an important point to make, that we don't want to just strengthen people. We also want to increase their awareness and and this sort of gets into more social questions here. But it seems that we shouldn't forget that what we're trying to do is help people at all different levels. And you might say, help people help people. And this is the idea of sort of its broad scale applications. Now, I've skipped over a lot, and I don't want to, overwhelm you, but I do want to talk about a little bit. Or let me turn it back over to you before I do. But I want to tell you a little bit about how breath is related, or why breath is related to heart rate.
I would love to go into that, actually. I would love to explore more of these kind of all of the interplays between these various things that people do as a technique. But just to touch on that thing that you just mentioned about holistic health, I really love you bringing that into a conversation about heart rate variability, because what worries me in the kind of biohacking world, which is where I first came across this sort of thing, is it's very it's physiological led. It's, how can you hack your sleep environment to improve your heart rate variability? Because people are measuring it overnight because it's the only time people are still enough to actually measure it for a long period of time, or they measure it first thing in the morning. And so it becomes these kind of outside in solutions all the time. And I find that a very reductionist way of thinking about improving health. And so for you to be speaking about this emotional control, emotional regulation, whether it's top down, or I don't know quite whether that's top down or internal out, whatever it is, it's this kind of the internal realm being as supportive to our holistic health and well-being as adding in any external things or changing things in our environment, I think is a great conversation to be had in the context of this kind of metric that's become a little bit commoditized, essentially. You compare heart rate variability scores with your neighbor or whatever it is, and I drank a glass of wine last night and my heart rate variability dropped by 20 points, and it's are we actually having a conversation about anything that matters here?
Yeah, the answer is no, and I really caution people to compare to other people. It's very unique. Now, there are norms and there's a certain distribution of it, but it's not that simple. It's reasonable and fair to compare yourself to yourself. And so you can you can look at changes over time, and there's quite a bit of utility, even if you don't know what the numbers mean, or even if you don't know where they came from. There's some value in becoming. It's just heightened awareness. And if I said to you, do you know what your heart rate is right now? And it's that simple. It's just kind of increasing that interoceptive awareness. And these numbers are a reflection of your internal environment, your internal milieu. And the idea is to bring it into consciousness, so that now when you start seeing this number, whatever it is, if it's a good number, you say, wow, let's see, and you think back on what am I doing that gave me a good number? Right. And you see a bad number, you say, well, what was it? What happened? Why is my number bad? And so it increases your self-awareness in a good way, even if you don't know the true depth of the physiology of it, and you don't know more than that. It's not a bad starting point. So it's not a research tool. It's not useful. These simplified numbers aren't really helpful in going too much further than that. But they are useful for checking your internal awareness, and kind of how you're doing compared to yourself.
Yeah, and how does this feel? Like, it's a good number today. What am I actually feeling inside in correlation with this thing that looks good? And as you said, what did I do differently? Where's my emotional state today? What are the things in me that feel like they're contributing to this good score?
That's right. And that's the very essence of biofeedback.
Yeah.
You can separate out the monitoring or recording from the biofeedback. Those are two completely different things.
Yes.
And you can't have biofeedback without some type of measurement.
Yes.
But you can have measurements without the biofeedback.
Right.
And so, at a basic level of research, the biofeedback is not necessary. What we're really looking at is what's going on with the physiology. And we can control that. We can, do sort of controlled environments and stress management. And, there's clinical and there's preclinical research on it. And those things don't necessarily involve biofeedback. Yeah. So I want to emphasize that when you get the number and you look at it and you think, what does that have to do with me? How does that relate to what I'm doing? You're doing biofeedback right there. The number is the recording, but the interpretation of that number, whether it's a graph or whether it's a single number or whatever that feedback is, when you get a number, a measurement, a recording, something that then feeds back information about yourself, now you're doing biofeedback.
Mm. Mm. It's such a great insight and really helpful for people in terms of, what are we actually doing with all of this data? What's it for? And I think that increasing self-awareness is something that I'm absolutely passionate about. And if it's a number of heart rate variability that can lead to that spiral of increasing self-awareness, then I'm all for it.
Right.
But take us back into the breath. I would love to hear you speak to the breath and the relationship to heart rate, etc. So,
all right. Well, hold on, because it gets a little bit, it's hard to say this too simply, but you can think of it as a metaphor of like a bellows.
Mm-hmm.
How you draw air in and you force air out. Now, the diaphragm or your cavity, your chest cavity, is a bellows. And the diaphragm below your stomach is a muscle. And that muscle is the equivalent of opening the bellows. So when your diaphragm descends, when you do belly breathing, you're drawing air in, just like the bellows. When you squeeze the bellows together or exhale, your diaphragm rises and it pushes the air out of your lungs, out of your chest cavity. That's the fundamental mechanism of breathing, simplified down. But the idea is that you're increasing and decreasing the volume of your chest cavity by belly breathing. That's why shallow breathing is so bad, or shoulder breathing, because you don't really draw in much air. You're only moving the bellows a tiny bit, and so you're not bringing in much air or pushing out much air. But the belly breathing, where your diaphragm is, when you extend your belly, your diaphragm drops. That increases the chest cavity, and that draws air in. When you exhale, the diaphragm rises, the chest cavity shrinks in volume, and air is expelled. Now, it's not only volume, it's pressure. It's the pressure inside your chest cavity. Now, you have to think of it as a closed system. When you increase the volume of that system by belly breathing, the pressure in your chest cavity decreases, because now there's more volume. When you squeeze, the volume decreases, and the pressure inside your chest cavity increases. Okay, got that? So you're going from large to small of your chest cavity. Well, that pressure has to go somewhere, and it goes into your vasculature. It goes into your, into the circulation.
Sure.
Because blood is being transferred from your lungs into the heart, and then the heart is then pumping it out. So you've got this cyclical, you got circulation of your. When your chest cavity is expanded and the pressure is low, then the venous blood flow back into your heart is affected by that. It slows down. It slows down the draw of heart return.
Sure.
So that means now your heart rate's got to accelerate to make up for that.
Yes.
Because that's the homeostasis. The homeostasis is you're trying to keep pressure equilibrated across the whole system.
Right.
Across breathing and circulation.
Right.
And so your heart is responding to these changes that are in your chest, the volume in your chest cavity.
Sure.
So that you can maintain. And that's the blood pressure connection.
Got
now,
the
sensation of this is in the baroreceptors that are a part of the heart.
Yeah.
So when you are breathing when you're breathing deep and slow, you're having these pressure changes on the circulation. The baroreceptors pick up that change in circulation. They send a message to the central nervous system, sends a message back down and say, let's adjust the heart then to account for this change in pressure. So you have this back and forth between blood pressure, which is driving your circulation, trying to adjust to the changes in your chest cavity. You see, so it's really a physical mechanism. There's a little bit more sort of, but basically it's a pressure volume. But the baroreceptors are detecting these changes in circulation. So there's a
Sure.
huge central nervous component in there. And if something is wrong with your sensor, with your brain or with the sensations, then you're not going to be able to manage these volume changes as they're affecting circulation.
That's so interesting. And what you don't know is that I once had a diagnosis of postural orthostatic tachycardia syndrome with various other things happening. And
that's right.
That whole element of my nervous system can't respond to the changes in pressure, especially, and I had dysautonomia as well. That's, as you explain that kind of pressure distribution shift, essentially, it makes total sense to me why in those moments when I was unwell, my nervous system couldn't keep up with the changes in pressure that I was trying to manufacture to shift all of the balances within my circulation versus breathing, all of that kind of stuff. That's right. That's a fascinating explanation.
Right. So it's all about homeostasis. It's maintaining system-wide. So you have blood vessel, vasomotor tone. Sure. You have blood pressure. You have heart rate, and you have respiration. And so all of those is very complex in that way. But there is a state in which all four of those physiological systems can become synchronized. Sure. And that is the coherence. That's the very desirable physiological state to be in. Yeah. We can't exist in a state of coherence. We can only achieve that under certain controlled conditions. But that's what this is all about. It's about strengthening the baroreceptors or practicing recovery so that you go from a stress situation to a recovery situation quickly, or you can quickly rest when the stress is off. So these are physiological indicators or responses that we can control with this top-down therapy. We can control our breathing, we can control our emotions. The whole concept of rational behavior therapy is thoughts control emotions. And I'm a strong adherent of that. And what we would counsel people back in the day was, there is no situation that's either good or bad, but only thinking makes it so. So you interpret external events and you have choice, you have control over how you respond to a situation. And once you grasp that you can control your emotions with top down means that your thoughts. Once you can control your emotions with your thoughts, which is a very desirable state. People who can't control their emotions are in a world of trouble, but you can control your emotions. You're sort of allowed to, you're given permission to control your emotions. That then enables you to more objectively see a situation and then adjust to whatever physiological state you ought to be in to deal with that situation.
Yeah. And in terms of this top-down controlling emotions sort of thing, can you give us a little insight as to the mechanisms or the patterns or what you do to actually achieve that sense of things? Because I feel like there's a lot of confusion at this moment in time. There's a lot of, should I say, fetishization of the trauma response things where people are like, it's all out of my control. They need to feel all this sort of stuff. And I think the power of our mind is being lost a little bit in this kind of putting the physiological, somatic, felt sense stuff first, front and foremost. So I really love that in this context of talking about the adaptability of our human system and how quickly we can move from stress to relaxation, which is a mark of a healthy nervous system. We are having the conversation about so much of this is involuntary control. Not involuntary, in our voluntary control.
Under voluntary control.
Good way of saying it. And I feel like just exploring some of those voluntary control mechanisms with you would be a great thing to do so that we're empowering our listeners to kind of have different thought processes about these sorts of things.
Well, first of all, we have to make a distinction between clinical and non-clinical populations.
Yes.
So someone with PTSD, it's not so easy. They're no longer able to have quite the level of emotion regulation that someone who has a more minor adjustment problem does.
Yeah.
And the emotional side, the emotion regulation side of treatments, of interventions for clinical populations, has different aspects to it. Yeah. And so in the case of PTSD, we really have to kind of do something about the traumatic event per se, and the same for depression. And it's very, very useful for anxiety, depression, and PTSD. This idea of heart rate variability gives us access into the emotion regulation. So in some cases, I would say the somatic experience would be a reasonably good place to start.
Sure.
But for some people, where they're not necessarily disordered, but maybe are not happy or want improvement, emotion regulation is easily within our grasp.
Yeah.
And I mentioned rational behavior therapy, and I would encourage anyone who really wants to go more deeply into emotion regulation, look at the literature. Albert Ellis, among others, Maxine Maltzby, the whole literature on rational behavior therapy, RBT, and rational emotive behavioral therapy, REBT. And there you'll find the well-established practices that leads to emotional thought control over emotions, the elimination of automatic thoughts, and the elimination of generalized trauma, so that you no longer see neutral stimuli as being threatening.
Sure.
So this RBT is really the very thing. It just goes under the name emotion regulation these days.
Yeah.
But the first step is generally to evaluate objectively or use evidence. You sort of, it's like a lawyer arguing a case to yourself. You're sort of arguing the pros and cons of this situation. What's the problem with this? What's the bad thing? And what's good about it? What's the good thing or the bad thing about not doing it? But objective evaluation of a situation. Many people just haven't come to the point where they can, as it were, analyze their situation, whether it's an emotional situation or a physical situation. The lights have gone out, or the weather's bad, or you're having trouble at work. But the objective evaluation of a situation, that is, the situation depends on what you think about it or how you interpret it.
Yeah.
And to begin to do that, you have to figure out what that situation is.
Really is.
So you eliminate emotion. That's where the rational part of rational behavior therapy comes in. It's a rational analysis of what the situation is. What are the facts? What are the pros? What are the cons? What are the consequences? The ABC, where you look at the antecedents, you look at the behavior, and you look at the consequences. And you analyze what those antecedents are. What's leading up to this? What are my options? What are my behavioral options? And what are the potential outcomes of different behavioral options?
Yeah.
And you can then you choose which one you want. It doesn't eliminate the stress. It doesn't free you from it, but it maximizes your coping ability to manage whatever that situation is and get whatever consequences you feel are possible or desirable. And you make choices. Let's say you make a bad choice. You screw up, you mess up. At least you can say, well, that's what I decided to do. Yeah. It didn't work out, but hey, I did it for a reason, and I know what that reason is. And you can substitute rationality for the word reason in there. I was rational. I made a choice. I did something, and here's the consequences. Yeah. Well, great. It worked like I thought it would, or it didn't, but I know why. And
also it's like you have agency, and the locus of control becomes inside oneself if you have that agency and made that choice, irrespective of the outcome. It feels like so much of the movement through the world can feel very disempowering. We feel like this outer world is way more powerful than we are. So it seems like in any of these moments, any tool that allows for that interruption point between stimulus and response, it returns the locus of control back inward, so that it almost irrespective of the outcome, we get to, feel like we played a part rather than we were just kind of swept along with everything.
That's right. And that's why it goes under really related but different terms: emotional control, emotion regulation, self-regulation, self-emotional regulation. I mean, they're all the same thing. They're showing that you do have the ability to control and decide and choose your responses. Now, of course, that's not, if you're in the desert, there's only so much you can do about controlling what your responses are if it's 120 degrees. But you can still manage, you can still make choices regardless of what the environment is.
And I would imagine it's a cumulative skill. So we start not being great at it, and also potentially not feeling like we are natural at it, but over time with practice, it must be kind of cumulative in terms of our ability to leverage this tool.
That's right. It is a practiced skill. And that's exactly right. It takes practice and you learn and your skill improves. And the same is true for the biofeedback. Once you acquire the skill, you just keep practicing it so that you can do a little bit of interoception on your emotional state and on your physiological state. And the more you do that, the easier it becomes. The more, I don't want to say automatic because that's sort of a loaded word, but the easier it is to shift or the easier it is to assert control, whether it's over your physiology or over your emotions. And it is practiced. And it's once you grasp it, it gets easier and easier and easier because of practice. So it's not just something, it's not a switch, but it is sort of an aha moment when you first, get that awareness. This is a good, let's keep doing it. Let's keep doing it. And so after weeks, after months, after years, that's when you see the changes.
And so are you noticing that the maybe not direct, but there is an influence on people's heart rate variability over time by allowing for more of this emotional control or whatever we want to call it? There is a definitive increase in their physiological state. Is that kind of a correlation that you see?
Well, I would just reword the question slightly as does your baseline, can you increase your baseline of heart rate variability?
Yes.
And it's really unclear. And, there's sort of debate about it. It would take a very long study. It'd be very difficult to actually demonstrate that empirically. Yeah. But from just a logical point of view, which is a reasonable place to begin to consider, seemingly, while it wouldn't increase your limits, because each of us has a limit,
the physiological
of
limit,
what we can do, right? And as well as emotional. I think it would be measurable. Certainly, it would be measurable as far as your heart rate variability under resting conditions.
Yeah.
Would it increase your stress management? Yes. Would it increase your heart rate variability in a stressful situation? Yes. Is that the same thing as raising your baseline? I don't know.
And that's the interesting thing to me. It's like we can measure this in resting, but we really care about it in stressful situations. It's like,
well, that's right. Well, there was a really exciting heart rate variability just hit, exploded about maybe half a dozen years ago. Some very enterprising person put on a telemeter of heart rate variability in a race car driver. And the idea was, gosh, is he going to have this super valuable, super impressive heart rate variability under racing conditions? And the answer is, well, yes, but he would also have, how are you going to compare that to the guy who hasn't trained himself to manage stress? So it's hard to make the comparison, but I think it's fair to say that overall, your expressed heart rate variability would be higher whether it's resting or under stress.
Sure.
So the term that it exercises your baroreceptors. Well, that doesn't really make sense because they're not muscles. But what you're doing is you're practicing the shift. And I think it's reasonable to say that you are increasing your flexibility. And that's another way. It's called autonomic tone, or autonomic flexibility.
Sure.
And so yes, it would increase your flexibility of heart rate variability. Sure as shooting.
And I think that's the other thing as well. It's like training to handle stress is this big thing at this moment in time. And I think people are somehow doing it in the wrong way. They're just like making themselves more stressed and assuming that their ability to be with more stress is training their ability to be with stress. And I'm almost like, I don't think this is quite the right way round. People I've been speaking to like Navy SEALs who are almost trained to minimize their natural ebb and flow by constantly being in hypervigilance, and people who are already chronically stressed doing supposedly eustress activities, whereas everything that you've said today feels very gentle on the system.
Right.
It's
that's
breathing.
Right. It is. It's low. That's right. It's low impact, and I can name you several training programs for special forces and SEALs where heart rate variability is a part of the training. And so if it's incorporated early on, but what you said is I would agree with too, is it's not a matter of strengthening your hypervigilance or it's a matter of increasing your receptivity or improving, like I say, the net, the size of your of the environments within which you can adapt. That's the important point. It's not strengthening, it's adaptability. That's what
Yeah.
the key is.
And I love that increasing, because there's so many like frames of reference that my brain goes to in terms of different disciplines, and everyone in the kind of trauma world will think of the window of tolerance. And I speak quite often of like expanding the window of tolerance, which isn't technically the right way to necessarily describe it, but it is. You can be with more of the peaks and troughs of quote unquote stress, whilst still having the capacity to, when there is a legitimate threat in the room, run very far in the opposite direction, but just not reacting to all of the non-threatening things.
Right. It's the key, really adaptability.
Yeah.
What we're doing is we're talking about improving and increasing adaptability to environment. And environment is where the variation is. So, the environment is where the very wide range of, you might even say measurable, but where what we're adapting to. So if we're adapting to a wider range of environments, then we've increased our adaptability.
Great. So in this landscape of heart rate variability, which is exploding, what do you feel are the relevant next questions that the field of researchers should be looking at? And what are you looking at? What are the open loops that we need to sort of look at and resolve, in your opinion?
Wow, that's a wonderful question. I mentioned the music, the utility of music, and I've said before that I think from kind of a simple-minded point of view, yoga, meditation, music, there are a lot of different acupuncture, but and there are studies that have related improved heart rate variability to yoga and improved heart rate variability that goes along with meditation. So it's those it's sort of the link between the emotion regulation, not the biofeedback, but a clearer model of how it is that these vague or unmeasurable things called emotions and thoughts, what is the mechanism? How can we trace that out neuroanatomically? Now, it's not a reductionistic argument I'm trying to make. I'm not saying, well, we need to understand the neurotransmitters and the electrophysiology that controls it, although that's a part of the answer. So I don't want to say but I do think elucidation of the neuroanatomical mechanisms and pathways, and that's a real challenge, but not a bad thing to do. And there's research going on at that level, preclinical too, about using amygdalar activation in consolidation of traumatic memories. Well, that's very neuroanatomical. Now those are preclinical. And so we can't get reports from our subjects about, what are the feelings, what are the thoughts and emotions. So I'm not proposing that we try to reductionistically measure thoughts and feelings, but that we look a little bit assuming thoughts and feelings, because they're so unique. This idea of soul and spirit, each of us is such an individual. But that's a box I'm not saying we need to open up. But after that, what are the details of how we get from that individual's spirit or their individual's feelings and thoughts and his life history and his interpretations and his values? Once we sort of get that, assume that, how does that relate then to this holistic health person that we are striving to manage?
Yeah. It's a fascinating thought process, and I really appreciate the distinction between the neuroanatomical specificity, because I think we can be so abstract in terms of like we're taking it away from humanness at that point. But there has to be ways to almost codify some of this stuff that we all instinctively know is good, meditation and yoga and those kind of things. It's like there has to be pathways. There has to be some kind of measurable, discernible something.
That's the black box. The black box is between thoughts and emotions and the physiology.
I was going to ask you if you had anything else you wanted to share today with our listeners, any other thought processes you wanted to close out on?
Well, it's a wonderful opportunity for me to reach the audience with a message that not only, I'm not the originator of this message, and I'm not the arbiter of it, but it's something, I sort of feel like I'm on the bus. And the more people we get on the bus that kind of think this way, then the more we can all kind of be on the same bus. We haven't talked a great deal about, and another area for research concerns the clinical populations. And we sort of aimed our talk at people who are really in position for RBT or in position to do this heart rate variability. But there's some clinical cases where they're not ready for that. It's not a part of their, and so I just want to say that while we've covered a lot of the waterfront, I think there still is a lot more to come with respect to heart rate variability as both an indicator, like I say, a public health screener of overall level of physical health, as well as potential for management of that for the clinical population. So people with diabetes, cardiovascular problems, cancer is very open now to incorporating heart rate variability as both a predictor and as an outcome measure. So, those are very technical, and so I don't know that we're addressing those clinical populations, but I would say if we can, it's a good place to start. You should be those of you who have chronic illness or chronic pain, it still is very, very valuable. And it's not just for the regular people or for the elite people. It's for everybody.
Thank you for sharing that and making those distinctions. I really appreciate you spending time talking through this kind of preamble and all of the detail that's in this, because it's such a deep topic. So thank you for running all of our listeners through these things and where the general populace can really find access points to support and therapeutics.
My pleasure.
What a tour de force, right, guys? I was thrilled to spend this time with such an expert in his field and someone who's been around this field for the progression and the development of so many of the shifts in technology, and who really understands the depth of what we're looking at when we're assessing these metrics of human physiology and emotional regulation. And just before you head off, I would like to inform you that when we stopped recording, Dr. Ginsberg informed me that the Heart Rate Variability Institute is having its first ever conference. And this is all about current and future applications in medicine, behavioral health, and human performance of heart rate variability. This conference is just one day. It is being held on September the 30th, 2022 in Greenville, North Carolina, but it's also being presented via live webinar. Now, I've seen the almost completed agenda, and oh my goodness, this is the discussions that we weren't having today. This is the clinical practice and so much more of using heart rate variability as a population monitoring tool. So we have a keynote of heart rate variability and the artificial intelligence therapeutics and outcome measures, a discussion of preclinical trials and studies of the vagus nerve stimulation as potential adjunct to exposure-based therapies, implementing HRV in private practice, use of HRV in emergency physician stress, iterations and improvements of the development of a heart rate variability prevention protocol, and Dr. Ginsberg himself will be giving a lecture on what we didn't get to in today's podcast. So using HRV as an indication of the common pathway of behavioral disorders, sensitized pain, chronic illness, and elite performance. He will really get into the validated index of autonomic function that can differentiate between states of health, behavioral disorder, and chronic illness. And that, I think, will be fascinating alone. Then there's more. There's the protective roles of HRV. There's compulsive grooming in rodents as a secondary effect of the activation of the anterior hypothalamic relay system of escape. Wow, say that 2 times fast. Honestly, this looks like an exceptional day. I myself will be looking into attending. It's incredibly good value. It is one day, and it will be a deep dive on all the things that we've discussed and so much more. So if today was of interest, I am 100% sure you will find that of interest. I currently don't have the links as I'm recording this outro, but they will be in the show notes by the time you get to listening to this episode. And if you are interested in health at all, either from the personal perspective or from a clinical perspective, I would strongly suggest that you look into it and think about attending for yourself. With that, all that remains is to thank you for your time and for listening to the Unveil podcast. And as ever, if you found today's episode useful and helpful, don't hesitate to subscribe, like, and share with your friends.